Hello, my friends. Welcome to the lecture of tuberculosis. Let's start.
Morphology of Mycobacterium tuberculosis. Mycobacteria are thin, straight, or curved rods, obligate aerobic non-spore formers. They cannot be classified as either gram-positive or gram-negative. They are classified as acid-fast and alcohol-fast as demonstrated by the Ziehl-Neelsen stain. They appear as thin pink rods, single or in small groups. Mycobacterium tuberculosis is not stained by the Gram stain because the cell wall contains a high amount of lipids, including mycolic acids, which form a waxy layer that makes it impermeable to most stains. Mycolic acid reduces killing effect. M. tuberculosis grows only on egg-selective medium Lowenstein-Jensen medium. It is an obligate aerobe, but 6,008% CO2 enhances growth. Slow growth rate, from 2 to 8 weeks. M. tuberculosis required selective media because it is slow grower and rapid grower organism, consume all nutrients in the media, and specimen is contaminated by many types of flora. Virulent bacilli grow on fluid media form serpentine cord, in which the cord factor hooked the bacilli together and arranged in chains. The tubercle bacilli cell wall is rich in lipids. Mycolic, waxes, phospholipids induce necrosis. The complex cell wall of lipid, polysaccharide, and proteins responsible for the granuloma formation. Sulfolipids make the bacteria survive intracellular by prevent phagosome and lysosome fusion. ESAT6 protein helps the bacteria escape from phagosomes. Mycolic acid, lipid layer make the mycobacterium resistant to acid, resistant to antibiotics, resistant to killing by complement, resistant to drying, resistant to gram staining. Medically important species that infect humans are: Mycobacterium tuberculosis is the etiologic agent of pulmonary tuberculosis in humans. Mycobacterium bovis is the etiologic agent of TB in cattle and humans, and the organism secreted in milk. The human infected by ingestion of milk from infected cattle and causes intestinal tuberculosis. M. leprae causing leprosy. Atypical mycobacteria. It is non-tuberculosis mycobacteria, NTM, worldwide distributions such as M. avium, M. kansasii, intracellular that causes chronic pulmonary lung disease simulating tuberculosis in immunosuppressed patient. Saprophytic mycobacteria. It is environmental acid. Fast bacilli such as Mycobacteria smegmatis. They are not associated with human illness. Non-tuberculosis mycobacteria. Opportunistic. It widespread in the environment. It causes chronic pulmonary lung disease. No person-to-person transmission. Resistant to anti-tuberculosis drugs. M. tuberculosis, transmitted by 1. Airborne, which the bacilli carried by air or droplet infection. 2. Hematogenous. 3. Ingestion. Primary tuberculosis. The site of initial infection is usually the lungs following inhalation of bacilli. They are engulfed by alveolar macrophages in which they replicate intracellularly with the development of delayed hypersensitivity after 6 weeks. The inflammatory lesion called tubercles, characterized by granuloma formation, consists of epithelial cells, lymphocytes, and giant cell. This pulmonary lesion called Gons focus. Gons focus, together with the enlarged lymph nodes, form the Gons complex. In this period, the tuberculin test becomes positive. Bacilli are disseminated by bloodstream to many organs. These are known as secondary sites. Both primary and secondary sites of infection usually undergo fibrosis and calcification. There are some organisms remain viable in a dormant form in these lesions. The patient have a latent infection. Reactivation occurs in about 10% of patients after months or years after primary infection. Site of reactivation, apex. Causes of reactivation. Reactivation spontaneously. Exogenous infection. Immunosuppression. The role of innate immunity in tuberculosis. Neutrophils attracted of bacilli but fail to kill bacilli due to lack of lipase enzyme. When macrophage attack the bacilli, sulfolipids inhibit phagolysosomes fusion. How macrophage do presentation of antigen. Antigen presentation by macrophage secrete IL-12. Lead to NK cells stimulation that secrete interferon gamma. Lead to stimulation of macrophages and T helper 1. Role of cell-mediated immunity. T helper cells have main role in immunity. Antigen presentation. Stimulation of T helper cell. T helper 1 secrete IL-2. Lead to cell proliferation. Interferon gamma. IFN, GAN-MA3 is produced by Th1 cells and is responsible for activating macrophages. Secrete cytokines lead to proliferation of lymphocytes and localization of granuloma. T cytotoxic CD8-YA1 cells contribute to the immune response against Mycobacterium tuberculosis by direct killing. The granuloma prevents the spread of the bacteria. Dissemination of bacilli through bloodstream to many organs such as brain, bone, kidney causing meningitis, renal tuberculosis, and bone infection. These are known as miliary tuberculosis. Tuberculosis in all organs. Tuberculosis is seen in people of all ages. Can occur at any stage after the primary infection. Clinical finding depend on the site affected. General manifestations: fatigue, weight loss, fever, night sweats, weakness. Manifestation of latent tuberculosis: asymptomatic and non-contagious state where the bacteria are present but dormant in the body. Positive tuberculin skin test. Positive quantiferin test gold standard. Normal chest X-ray. Positive tuberculin skin test. Positive quantiferin test gold standard. Normal chest X-ray.
Laboratory diagnosis: specimen. Sputum, not saliva. 3 morning sputum samples collected on 3 consecutive days should be examined as follows. 1. Direct smears are made from the specimen and stained with Zeil-Nielsen stain. 2. Decontamination and concentration of sputum by NaOH to kill all bacteria except TB, and the deposit is cultured on LJ medium and incubated at 35,037 OC. Growth appears up to 8 weeks. Rapid diagnosis can be done by detection of DNA in the patient's specimens by PCR, quantiferin TB test. It depends on measuring of interferon gamma released. When the blood of tuberculosis patient or latent infection is mixed with specific protein derived from tubercle bacilli such as ESAT6 or CFP or specific tuberculosis antigen, BACTEC system demonstrate culture on media containing C, labeled palmitic acid. The growing bacteria utilize the palmitic acid and released radioactive CO2 detected by machine indicator tube demonstrates. They culture on fluid media containing fluorescent sensor. When mycobacteria consume O2, produce fluorescence that detected by UV. Advantage of quantiferin test: 1. The results available within 24 hours. 2. Required only 1 visit. 3. No false positive, because it's not affected by BCG or non-mycobacteria. 4. Quantiferin test is more specific than tuberculin test, because not affected by BCG or NMT. It is skin test used for demonstration of delayed hypersensitivity reaction to tubercle bacilli. The material used is purified protein derivative, PPD, extracted from tubercle bacilli. 0.1 ml of PPD is performed by intradermal injection in the forearm A positive test is read as red induration area, raised and hard, measuring not less than 9 millimeters that appears after 48,072 hours, the best time of reading. The induration is due to accumulation of antigen-specific T lymphocytes that are activated and release mediators that attract macrophages and polymorphs to the site of injection. A positive tuberculin test indicates that an individual has been infected in the past and continue to carry viable bacteria. It does not imply that active tuberculosis is present and produce false positive or negative. We use tuberculin test to diagnose active infection in infants and young children. 2. To measure prevalence of infection in an area. Indication of successful BCG vaccination. To test cell-mediated immunity, we prevent tuberculosis by BCG vaccine. BCG is a living attenuated vaccine prepared from attenuated M. bovis tubercle bacilli, called BCG, Bacillus calmette-guerin. It is given a single dose of 0.1 milliliters. Intradermally in the deltoid region. It is compulsory in Egypt. Except in the case of infants, up to 3,006 months, and not vaccinated, tuberculin test should be done. The only negative infant are given the vaccine, newer vaccine, recombinant BCG vaccine. Thank you for watching. See you in the next video. Assalamu alaikum.